I'm Roland Nyein. I'm a OBGYN. I've been in practice for 21 years. The Pandion group provides discounts for a lot of our medical supplies, and the savings is a key for a small private practice like ours, where we can save so much money by being part of a buying group. We do a lot of hysteroscopies on people who need endometrial sampling, so perimenopausal patients with irregular bleeding, postmenopausal people who have bleeding, postmenopausal bleeding. We also take out a lot of polyps. I actually get a lot of referrals from local gynecologists where the patient doesn't want to have a procedure in the hospital, and we'll offer hysteroscopies in the office, and we'll remove polyps. A LiNA scope, the OperåScope, we use a lot to remove polyps. It's a very good scope that's disposable, that's portable, that has a great operative channel that we can remove a lot of polyps, large polyps even, with the scope. We don't give anesthesia when we use the OperåScope. Sometimes, if the patient requests, we'll give some local anesthesia, a paracervical block. In most cases, we won't. We'll pre-medicate with ibuprofen about 2 hours before the procedure, and sometimes we'll give misoprostol, about 400 micrograms, the morning of the procedure or night before. I would say 90% tolerate it very well. There'll always be a patient or two that doesn't tolerate it, in which case we'll just stop, but most patients tolerate it well without anesthesia. It's a simple procedure. We oftentimes would do it in just a regular exam room. All you need is the scope, an IV bag, an IV pole, and a sterile bag to collect the fluid. So oftentimes we'll do a complete workup before. We like to know what we get into before we get into it. So we'll oftentimes do a sonohysterogram to evaluate the lining, to look for polyps and fibroids, and we'll decide based on what we find on sonohysterogram whether to do it in the office or do it in the ambulatory surgery center. So I think office hysteroscopy is very different from hysteroscopy in the AM surgery center or in the hospital OR. It's a totally different procedure for us, because we have to worry about the patient's comfort, and one of the ways that we can do it without anesthesia is if we do it vaginoscopically. We'll use this to fill the vagina with saline. We'll identify the cervix, and we'll just actually thread this through the cervix using hydrodilation of the cervix, which is much less painful or uncomfortable than mechanical dilation with a dilator. So we'll do it vaginoscopically, enter as bluntly as possible with the tip of the scope, and then we'll do what we need to do intrauterine wise. But it is a lot less painful if we don't even have to place the speculum in. I like the scope a lot because it's a rigid scope that kind of acts as its own dilator in a way. It's a short shaft, and it's very rigid, so it allows for very easy entry into the uterus. We have them rest for about 10-15 minutes, then we take their vital signs, and then they can leave if they're okay. The mechanical dilation of the cervix that causes kind of that parasympathetic response. I think we see it less in the office if you do it vaginoscopically. If it's the hydrodilation instead of mechanical dilation, if you let the cervix, if you place this tip against the cervix and wait till the cervix relaxes. I think initially, some people they get initial spasm of the cervix, where it's tight, and if you place it against the os and let the fluid kind of do its thing, and the cervix relaxes again, you get less of that. But if you get less dilation, you get natural dilation instead of a mechanical dilation of the cervix because it. And I think the more you do it, the less vasovagal you get as you get more experience doing this. 10 minutes. So actually we work it through the day. We don't have a specific day where we do surgery because a hysteroscopy can take the same amount of time as just a regular routine office visit a lot of times. So we'll just do it as they come in, and we'll work it throughout the day, throughout cycle. We won't specifically schedule an office day for surgery. We don't need to do that. It's streamlined. You have it makes our day easier. It makes it more fun because you have a couple of procedures to do, and it kind of breaks up the day from the routine monotony of just seeing patients throughout the day. So we like to book these like small procedures throughout the day. It's tremendous. You know, you don't have to take morning away to do surgery and ambulatory surgery. I can do a hysteroscopy and ambulatory surgery, take 10-15 minutes, but it actually takes 2 hours of your day waiting for the OR to get set up and waiting for the post-op, and so this saves a lot of time. I'm seeing more and more patients requesting office hysteroscopy if possible now. It's not just more comfortable. It saves them so much money too because of the extra co-pays and co-insurance from doing surgery in ambulatory surgery or in the OR. So and patients like it because it's actually more comfortable, and they prefer our patients. We have a patient population that hates to go to the hospital, that doesn't want to get anything scheduled in the hospital, and they like doing it in the office. And it's something we can offer them that. You know, to avoid the hospital, to avoid all the kind of, because they have to, when you do something in the hospital, they have to take the entire day out of, entire day to get this procedure done, to travel to the ambulatory surgery department, to have someone pick them up or someone stay with them, and so they save a full day too, and we save a lot of time, so it works out for both of us. The OperåScope, the LiNA scope, is totally disposable. All the instruments are totally disposable. We have an autoclave in the office, but we can do this without having an autoclave, without sterilization, which is really helpful to us because it also saves a lot of time in reprocessing. Like I said, we don't have to think about it. I can book 2 back-to-back and not have to worry about sterilizing our hysteroscope, having the patient wait, and it takes about 2 to 3 hours to sterilize something, to process something. So it really saves a lot of time for the patient and for us, and allows us to not have to think about scheduling a patient, spacing them out adequately. Like I said, we can schedule a patient as throughout our day of seeing patients, and it's really helpful for that. Large polyps that we can't take out in the office, we'll do it with MyoSure True Clear in the hospital, and it's a totally different procedure. Cost, the problem is there are morcellators, handheld morcellators now coming out. I don't see them doing well in the market because of cost. We do this in the office, it saves time. The reimbursement's pretty good, and you can take out a lot of polyps, but those morcellators for us, we evaluate them, and they're probably too expensive in the office to make it financially worthwhile. We do some histograms in the office, so we know, and then we're not. So a lot of times we won't do a hysteroscopy in the office because we're going to take them to the operating room. So it's replaces. We'll do one procedure. We do the right procedure for them. This is a major difference and major advantage of doing hysteroscopy in the office is we also do it under ultrasound guidance. So when you're doing a vaginoscopy, you're threading this through, we can actually see the tip on ultrasound abdominally, and we know the direction, we know if we're in the right spot, if we're pushing the wrong way, we know exactly where to push, what angle to push. It's anteverted, retroverted uterus helps us get in so much quicker and so much less painful because we know we're getting at the exact right angle into the uterine cavity. There are plenty of difficult cases, where if someone has a stenotic cervix or it's a little hard to get in. It's so helpful to know the direction of the uterus, and if you're kind of on the right track, we can see the tip of this on ultrasound, which if we had to do this in the hospital, you have to call for an ultrasound machine. It's going to take 20 minutes to get the ultrasound machine, and then half the time you can't see much because the ultrasound machine is so old that you can't actually see anything when you do it abdominally. So really helpful kind of advantage of doing this in the office versus in ambulatory surgery.